Dear learners, welcome back to NPTEL online certification course on novel drug delivery systems. I am Dr. Satish Devanapelli, working as assistant professor at Department of Pharmaceutical Sciences and Technology, Institute of Chemical Technology, Mumbai. So, in our novel drug delivery systems, we started with the targeted drug delivery systems. In that, we are discussing on various targeted drug delivery approaches. In our previous lecture, we have discussed what are the various targeted drug delivery strategies, and we have seen the introduction on the targeted drug delivery systems, and then we have discussed on the various targeting strategies, and after that we have seen stimuli responsive target drug delivery systems, and then we have discussed even multifunctional target drug delivery systems. In our previous lecture, we have discussed on the tumor targeting systems. So, in that we have discussed what are the tumor microenvironment and what are the possibilities which happens with the tumor compared with the normal cells, and with that we can also use that physiology, we can target the tumors by using the tumor microenvironment. So, here we have discussed various tumor targeting strategies, in that active targeting, passive targeting and other cell and organ based targeting strategies also we have discussed. And then we have seen the one case study of the tumor targeting with the folic acid targeted approach. So, in my today's lecture, I am going to discuss on the another delivery systems which are brain targeted delivery systems. So, here we are going to discuss what are the brain diseases and then what are the challenges in the brain delivery. So, in that we are going to discuss on the two different components. One is physiological challenges, another one the related to drug, that is the drug development challenges. And then in third we are going to discuss on the what are the approaches we can utilize to overcome all these challenges, which are nothing but opportunities to overcome the brain delivery complications. Now, then we are going to see on the what are the specific targets we can utilize it to develop brain target delivery systems. And the fifth, we are going to discuss brain targeting with the one type of approach, that is the nose to brain delivery, and then we will see the some challenges, and also we will end up our session with the case study. So, yes, as we know, these are the various types of the brain diseases, example neurodegenerative diseases, acute ischemic stroke, and the brain tumors, which is not limited. There are the infectious diseases, and then the traumatic brain injuries, and even though psychiatric and functional brain disorders. So, we know that with all these brain diseases, we will see there is a lot of health issues and also in the burden in the society, that with the high morbidity and the mortality rate. So, yes, to overcome these challenges of the brain diseases, we need to target with the different strategies. So, today we are going to discuss on that the challenges and then what are the strategies we can implement to treat the brain diseases. So, here these are the few challenges. As we know, when we talk on the brain, so we remember the blood brain barrier is one of the major limitation as in physiology, because it has a tight junctions which will not allow the molecules to reach the target sites of the brain. And yes, so that will block the 98% of the drugs entering into the blood. So, because of that, blood brain barrier is one of the rate limiting step in the brain delivery. So, bypassing and the crossing targeting into the brain is very critical. So, we need to look some of the bypassing strategies for the brain delivery. So, and then and reaching into the blood cerebrospinal fluid barrier is one of the major issue. So, with that various strategies we can also reach into the blood cerebrospinal fluid barrier. And efflux transporters, as we know that the example is paraglycoproteins pumps, which will efflux the molecules from the cell to outside, because these are the efflux transporters which will leads to the decrement or reduction in the efficacy. So, to overcome the efflux transporters, we have a multiple strategies. With that, we can also avoid the efflux transporter mechanism. Enzymatic degradation, one of the major issue in the brain targeting. So, we can use various carrier systems, and with that we can protect the metabolic degradation in the brain. As we know that tight junction which will not allow the molecules to reach the brain. So, we can use various strategies. With that we can avoid the functions of the tight junctions in the blood brain barrier. Rapid clearance also one of the major issue. So, your therapeutic level of the drug will go down because of the rapid clearance. We can use various targeting strategies. With that we can increase the concentration of the drug in the brain. So, heterogeneity of brain tumors, the changes which happens in the tumor cells which will also leads to the targeting is very critical. And of course, when you can also do with various types of the nose to brain delivery, but the surface area is very less for the large doses which were not suitable for the targeting. So, these are some of the physiological challenges in the brain delivery. So, now we are going to see some of the drug development or drug related and the formulation related challenges in the brain delivery. So, as we know, for a drug the optimum solubility and the permeability is required to reach into the target site and to cross the barriers. So, here the poor solubility is one of the major issue. So, with that we will see the reduction in the absorption and the bioavailability. And as we seen in the previous slides also, the instability because of the enzymatical and the various physiological condition that degrades the molecule, that is also one of the major issue with the drug development issue. And yes, because of their physicochemical properties, they are enabled to cross the blood brain barrier because of the low permeability. So, these all factors we will consider during the development of the molecules or development of the formulations for the brain targeting. And burst release also, which will not effective because it will not show the sustained action in the target site. Yes, we can also use various carrier system, but that will accumulate in the body, that leads to the toxicity. Large molecule that which cannot cross the blood brain barriers, and also scale up is one of the major issue. Even though you come up with the innovative and the novel strategies for the brain targeting, but the scale up is one of the major limitation, and of course, that is connected with the regulatory challenges. We do not have the standard or established regulatory guidelines because of that the nano systems. So, that is also one of the limitation. The targeting accuracy, and yes, because of the response or the overexpression of the various receptors. So, target accuracy is also limited, and the cost and complexity also is considered as in a drug development challenges compared with the conventional formulations. So, based on this the challenges, the scientists have developed various types of technologies or drug delivery strategies to overcome the challenges in the brain delivery compared with the conventional delivery systems. So, that we are going to discuss what are the novel approaches in the brain targeted delivery. So, here we can see these are the various approaches. This can be classified into in a simple format into the 4 categories. So, first comes with the novel drug delivery system, that is the nanoparticulate drug delivery systems. Yes, by using active or passive targeting encapsulating of your the drugs which will show for the activity at the brain site. So, we can encapsulate that we can deliver into the different routes, either we can give by the nose to brain delivery, parenteral routes, and also directly you can give into the brain by the various strategies. With that, yes, we can avoid the all type of the limitation which are comes in the delivery of the brain. So, which can bypass or which can cross the blood brain barrier compared with the conventional systems. So, and the second one is the physical method. Nothing but here what we do, we apply some of the physical energy in terms of it may be ultrasound, it may be magnetic therapy, it may be some pH sensitive strategies, or by using different strategies, temperature sensitive, by applying of the heat. With that, by using the physical method, we can also improve the accumulation of the drugs in the brain. With that, with these methods, we can also cross the blood brain barrier. And the third one is the biological method. Nothing but here what we do, we use some biological strategies by taking the viral vectors and also by using the cell penetrating peptides and the exosomes and other receptor target delivery. So, with all this we can also cross the blood brain barriers. And the third one is the chemical method, nothing but modifying of the drug molecule. For example, here is the prodrug. So, you can convert your drugs into the prodrugs which are inactive outside, but once enter into the target site, so there it will generate, it will cleave from the molecule and it will give the active molecule that will show the therapeutic effect. Not only that, if any drugs have a low permeability, you can conjugate with the lipophilic molecule which will help to travel through the cell membranes. So, that will improve the permeability also. So, these are the various types of the approaches by using nanoparticulate, physical method and the biological and the chemical method, we can also target the brain. So, these are the one example of carrier. Now, you can see this is the blood brain barrier. So, you can see these are tight junctions crossing through blood brain barrier is one of the rate limiting step. Yes, by using carrier with the different mechanisms, by using receptor endocytosis mechanism and by using the functionalization of the carrier system, even carrier itself work as the passive the transportation mechanism which will carry n number of molecules through the blood brain barrier. Now, we can see the various carrier systems. With that, we can cross the blood brain barrier. So, when you compare with the plain drug which may not transfer, which may not cross the blood brain barrier, but when you encapsulate in a carrier system, that will increase the accumulation of the drug in the brain. So, with that we can also target the brain delivery systems. So, in the fourth topic we are going to discuss on the specific targets for the brain delivery. So, here as we know that in case of the cancer also we have discussed by targeting with these ligands, we can also improve the brain delivery. So, for example, you can use transferrin and the transferrin antibodies, insulin like receptor, apoprotein E, peptide 2 and glucose based ligands and some other molecules. With that, we can use as a function of the receptor mediated endocytosis and some other mechanisms. All these functions can be used and we can target different receptors in the brain. So, with that, by using a specific targets, by functionation with the targeting ligands, we can increase the accumulation of the drug molecules in the brain. So, the specific targeting also one of the approaches we can utilize for the brain targeted delivery. So, now in the approaches we are going to discuss on only one topic, that is the nose to brain delivery. So, it is one of the potential approach in the brain targeting. So, as we know, we are discussing the blood brain barrier is the one of the major limitation, because of the tight junction we will not allow the molecules to reach to the target site. To bypass of the blood brain barrier, so nose to brain delivery is one of the potential approach in the brain delivery strategy. So, yes, we can also protect the so, here there are the important points on the nose to brain delivery, because when you want to target any type of disease, so here you can use this a safe and effective method. With that we can approach the brain delivery, and not only that, which is a non-invasive systems, and which, yes, your molecule can reach fastly, and these are the potential compared with the conventional system, and with this you can also improve the patient compliance. So, here in the system you can see, so by delivering the molecule through the nasal route, through the intranasal route, so the molecule is reaching through this system. So, we are going to see the mechanism in the next slides. So, here it follows the two types of the mechanism majorly, that is the olfactory and the trigeminal nerve pathways. So, in the picture you can see, so the nose to brain delivery. So, we need to administer by some device to the nose. So, the formulation, either it may be nano carrier or any suspension or emulsion, so that will adhere to the nasal mucosa, or you can also use some sprays, nasal sprays. So, the best thing in the nose to brain delivery, so here we can bypass the blood brain barrier, because it will directly connect with the olfactory pathways. So, here we, with that you can reach the molecule into the brain site. So, that is a great advantages compared with the other pathways, and this trigeminal pathway also can bypass the blood brain barrier. So, these two strategies will help us to reach the brain through nose to brain delivery. So, these are the some of the important parameters we need to consider while developing the nose to brain formulations. So, these are the various carrier systems. So, these are the well explored materials in the nose to brain delivery strategies. So, for example, polymeric nanoparticles, solid lipid nanoparticles, nanostructural lipid carriers, liposomes, transferosomes, ethosomes, and mucoadhesive and the in situ delivery systems has a huge demand in the nose to brain delivery strategies, that we are going to discuss on when we are discussing on the challenges. And yes, nano emulsions, microemulsions also possible, micelles and the exosomes can be used for the nose to brain delivery. So, if you want to develop any brain delivery, so you must consider these are the features which are very important for while developing. So, yes, your material should be biocompatible and the non-toxic while considering all these strategies, and your material should be mucoadhesive, because that will increases the residence time at the nasal mucosa, and your particle size should be below 200 nanometer, and the material should be protect from the degradation. It should allow the controller sustained release, and also that surface should be modifiable, because you can also function with the various ligands as an active targeting delivery system. So, for any type of the nose to brain delivery, we need to consider these characteristics as a carrier system. Now, these are the challenges we will face in the nose to brain delivery. As we know, we have discussed, you cannot give the in the higher value, that is one of the major limited. You have to give it in the limited dose volume, that is in the 25 to 200 microliter. So, that is one of the major limitation. Yes, the treatment is effective, but the dose volume is very, very less. And the second major issue, mucociliary clearance. So, this is the defense mechanism in the body. Wherever mucoadhesive or mucosal system is there, so they are the mucociliary clearance system which will remove the mucus from that site. It is a defense mechanism. It will remove the all type of microorganisms and the debris, dust which comes from the outside. So, yes, with that process, your formulation or your drugs may be cleared from the nasal cavity. So, how to overcome this? By using the mucoadhesive polymers. So, with that, because it will adhere to the mucus or with the biomembranes, so that we can avoid the mucociliary clearance. This clearance is varies from the one place to another place. So, we need to consider the mucociliary clearance while developing the formulation. As we know that we have discussed, enzyme degradation also possible. There are the enzymes that will undergo the degradation of various biological molecules. Yes, poor permeability. So, that case we need to use the lipid based systems, or we need to modify the permeability of the molecule. Irritation is a major problem. Yes, you must use the approved or safe materials for the development of the nose to brain formulation. Anatomical and physiological variability, that will vary from the disease, age, and also based on the congestion can affect the absorption. Short residence time, same formula. Here we can use in situ gelling systems, or we can use mucoid system. With that we can extend the retention. Lack of standard delivery device. So, yes, for all this nose to brain delivery we have to provide with the devices. So, then only we can administer. We cannot use it as a like oral formulations. There you no need any device, but here you need a device for the nose to brain delivery, like similar to the pulmonary drug delivery systems. So, device is must. With that only we can improve the efficiency. Even though your formulation is same, if you put a drops and if you convert into the with a device as a spray, the efficiency will vary. So, device is a must for the nose to brain delivery. So, in this case study we are going to discuss nose to brain delivery. So, here the one molecule, that is L-tryptophan hydrobromide, which used for the migraine, and here the scientists, so they converted this conventional formulation of the L-tryptophan hydrobromide into the nano formulations. So, yes, as we know that these tryptans are serotonin receptor agonists, so which will help in the treatment of the migraine. But this drug has a low bioavailability and the low brain targeting. So, to overcome these challenges, so researchers converted this into the solubilized format into the emulsomes by using various phospholipids by thin film hydration method. So, with that the solubility can be improved. And now, after the improvement of the solubility and developing of the formulation, so the researchers studied the biodistribution in the mice. the researchers used the mice and they studied the in vivo biodistribution and they compared with the intravenous formulations. So, here now you can see after administration of the intranasal solution and the intranasal emulsomes and intravenous solution, they have compared the concentration of the drug in the brain. So, after administration they remove the brain and then they done the homogenization and they have seen the distribution of drug in these 3 treated mice. So, now here we can see this graph will explain. So, here you can see the drug in the brain. So, concentration of drug in the brain, that is represented in nanograms per gram, and here you can see the time per minute. So, after every time interval, so they sacrifice animal and they have seen the percentage of the drug in the brain. So, that is speaks about the biodistribution. Now, by seeing this fact you will understand the solution, the concentration is very less, that is you can say below 20% throughout this study. Whereas, the intravenous solution, you can see the initial 30 minutes or initial 60 minutes, the concentration is around 50 to 680, but later the concentration is decreasing. So, again these two systems are not effective. Whereas, in case of emulsomes as in a nanosystems, definitely that will improve the solubility, also it will help for the targeting. So, now we can see the improvement, it is going from 80 to 140. From this what we will understand, there is a requirement of carrier, and also there is a requirement of the change in the route, because here you can see, so the intranasal will showing the maximum delivery. So, it is almost 140 and now that is sustained for almost 480, still with the almost 60% of the concentration. So, yes, by converting of your formulation into the nano formulations, definitely that will enhance the solubility as well as you can go ahead for the targeting. So, with this what we will understand, so nose to brain delivery is the one of the potential strategy for targeting of various types of the brain diseases, including neurodegenerative diseases, brain tumors, other type of infections and of the brain. So, with this we are going to stop today's lecture. In our upcoming classes, we are going to discuss on various novel drug delivery systems. Thank you so much.